Hi, my name is Lisa Anderson. I'm the owner of a Healing Place Complete Counseling Care, which is located in Wisconsin, but I live in Evanston, Illinois, which is south of Highland Park, Illinois, and the shooting that just occurred today at the 4th of July parade. I felt a very strong need to post something. I'm hoping I can get this onto the Facebook Highland Park page so that the people who experience this can see this, but I also will be posting it in many different places, including my YouTube page. But I first need to just say, with all, sorry about that, it's just sad. With all sincerity of what has occurred to people who are just trying to enjoy their day, I am so sorry. I am a licensed professional counselor. I'm a certified de escalation debriefing specialist, and I'm also a certified specialist in trauma. And I felt that I needed to get something out there for the individuals that witnessed what occurred and how to maybe help themselves in the next few days, weeks, and months ahead. Many people saw a lot of very frightening images, and those images are very hard to get out of our brain once they're in there. And those images and the experience of that trauma can create a lot of physiological effect onto our body. It's very normal after a traumatic event, especially for the first, right after the event, for the about first 2 months, to have what's known as an acute stress response. And this can be where you are struggling to sleep, you're seeing these images again and again and again. You may be more irritable or crying more frequently. You certainly are not as trusting or believing that the world is safe because your worldview has shifted, unfortunately, due to what you've experienced. You will feel like your safety has been taken from you. You will be angry. There will be a grief response to this. The grief response will not just be to the loss of safety, but if you were somebody who was either injured in this or somebody that had a family member that had passed away in this, the grief of the loss of that, grief and safety feeling of this community. Highland Park is a very tight knit community, so this is going to fracture them to some extent. So, all of those things are what is very normal to feel after an event like this. You may find yourself trying to turn to ways to avoid. Avoidant techniques are checking out on social media, binge watching TV, using alcohol or other drugs, not getting involved in activities, sleeping more. Those are all ways to try to check out and not have to deal with the feelings that you're having. The other side of this is you may become hypervigilant. You may become hyper emotional. You may find yourself struggling to manage your emotions and tears and sadness about the event that has you experienced. All of that is normal. You are not going crazy. You may feel aches and pains in your body because of what you've experienced. So, all of that is normal. What can happen if you don't get into some type of help as soon as you possibly can is this can shift into more of an acute and long-term trauma response and go even move into a post-traumatic stress disorder diagnosis. And so it's really important to try and reach out to either your clergy or somebody in your faith, reach out to your doctor or your nurse practitioner, and reach out to a therapist or a counselor because you're going to be having a lot of things occurring, and it really does take somebody who's in a more professional realm to help you figure out some of those pieces. The next piece of that is your informal support structure around you. Those would be family, friends, colleagues that can help you, neighbors who can help you struggle or help you manage the struggle that you're feeling. You are going to feel different. If this starts moving into a post traumatic stress disorder, you're going to start finding yourself struggling to focus at work. You're going to have significant and extreme hypervigilance. You may struggle with sleeping or may sleep too much because you're trying to avoid. You may find yourself crying more. You might start having symptoms of depression. You could start thinking about suicide. These types of events impact not just our physical sense, especially if you're injured, but they get into our brain and create what I recall a trauma scar on your brain. And you will have a trauma response because of that. There is a psychologist that wrote a book, and his name is Dr. Bessel van der Kolk, and the title of that book is The Body Keeps Score, because we don't just have, our brains aren't just up here separate from our whole body. Our body and neurobiology retains that trauma. So it's so important to get that help. Children are going to have nightmares. They're going to be, if they're very likely to regress in age. You may see if you had a child that was potty trained, might now regress back into that. Be very fearful of letting parents leave them. Be fearful of going into strange places. It's so important that children get some debriefing and some therapy and counseling during this time to prevent it becoming a longer term issue. And so it's really necessary to find those therapists within your community. Unfortunately, I'm not licensed in Illinois. I'm trying to get licensed in Illinois, but it's actually a little more difficult than one would think. But I can help people in a counselor slash coach role. So I do parenting counselor coaching. I do life coaching also. And I can certainly help out in those kind of realms and help just educate about neurobiology and trauma and ways to try to de escalate. Here's the things you can do to help yourself. You definitely want to get, like I said, all that professional help. Recognize you just went through an extreme trauma. Don't be too hard on yourself. Give yourself a break. You're not going crazy. You shouldn't be stronger than this. You don't have the way to beat your neurobiology. Nobody does, and it's important to understand that. The second piece is try to stay away from unhealthy tech mechanisms like drinking, like drugs, like checking out. Allow yourself to feel the feeling. I say this to just being as you're honoring this feeling. So let's say you have a moment of fear or you have that image. As scary as this is, that if you can pinpoint where am I feeling this in my body. So let's say it's fear, anxiety, tends to show up in the chest. Feel some pressure, feel some pain in the chest, and you will feel that emotion. Close your eyes and allow yourself to just feel it. Focus here in that feeling. It's going to climax to a high point and then come down. If you can stay with it, it will come down and you will feel more relaxed. Deep breathing. Not just, but you want to breathe in all the way so that your belly to the deep of your diaphragm, and you want to breathe out slower than you breathe in. Doing that several times. If you have a youngster, use your thumb as a birthday candle. We're going to blow out the candle now. Or let's pretend we're going to jump in the pool. Hold our breath. Okay, we came out of the pool now. We can breathe. So that you can help younger children do this. Hold your children. Hugs. I cannot give enough emphasis on hugs. We have neurobiology and nerves that as soon as we touch, it releases oxytocin. Oxytocin is the calming down, love you chemical in our body, and it can just such a good job of helping you feel more stabilized. And cry, 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 because that is what you need to do right now. If you would like any assistance from me, I do not plan on charging anybody who has been involved in this particular activity. I will help you in any way I can. You can reach me through my website, www.ahealingplaceccc.org, or you can reach out to our general email, info@healingplaceccc.org. I'm sorry, the website is www.ahealingplaceccc.com, not org. The email is the org. So please reach out to me. I know that there were many therapists saying, I can help, I can help, I can help. I think many of them will be very willing to do things for free to try and help get through this. Any way that any therapist can help, they should be reaching out to do that. I did reach out to WGN and just recommend that they get a therapist on live to talk about everything I just talked about to try and help people. But please don't be afraid to reach out to the professionals. You're not crazy. You just experienced a trauma and you're going to need help with it. In the meantime, you are all in my heart. I am your neighbor. If there's a vigil, I tend to be there. I tend to do whatever I can do to help. And truthfully, I think I'm getting to the point where I'm thinking about running for Senate because I don't know that I can do this anymore about these shootings. That's another thing, by the way, you can do. How can you help on a community level? That can be very, very healing. Bless you all. You are all in my thoughts and prayers. And if you need me, I'm here for you.